Good morning and welcome, everyone. I am Julie Klima. I am the Managing Director here at the Midwest Center for Nonprofit Leadership, and we are so excited to have our team share the results of the research they did to map the homelessness ecosystem here in Kansas City. But before we get to that, I want to give just a little bit of context for those of you that may not know. The Midwest Center for Nonprofit Leadership is dedicated to enhancing the performance and effectiveness of the regional nonprofit community through education, research, and service. So today's discussion is part of our Nonprofit Navigation Program, which is a semi-regular educational series about timely topics that are pertinent to the nonprofit community. Today's program is special because it's part of a larger project related to the houselessness issue that has been funded by the Block Family Foundation and the Hall Family Foundation. So you can learn more about our education, research, and service offerings on our website at mcnl.org or by reaching out to me directly, and I will drop my email in the chat. So with that, I will go ahead and turn it over to my colleagues, Dr. Dave Renz and Cindy Laufer.
Well, good morning. Thanks for joining us. I'm pleased that Julie's here to introduce the program. Welcome, Julie, to the Midwest Center. It's super to have you taking the helm and leading the projects and keeping the ship moving forward, which is kind of wieldy sometimes. Not the center, but we're all in a bureaucracy. So what can you say? So anyway, it's a pleasure to be here with all of you and to talk about this project that we've been working on for quite a while. We actually tried to start it early in the pandemic, and that didn't go quite the way we had wanted. So we did a little bit of rebooting, but we've been working on this now for about 18 months, and it's really been useful. You'll see that my colleague Cindy Laufer, our colleague Cindy Laufer, is on the screen. Cindy is also, she'll be presenting a little bit of information, but she's also tracking comments or questions. And so if you have questions, feel free to put them in chat. We will have a little time at the end of the session for questions and comments as well. But when something occurs to you, feel free to pop it up. The reality is a lot of what we have, I will just own up to this right now. I have broken every cardinal rule of PowerPoint out there, I think, because there is more data and there are more words on every slide than would be the case. I actually think Zoom is a better vehicle for looking at this from that point of view. But we're not going to look at the data cell by cell. We're going to be talking, I'll post the data, but I'll be highlighting things in the graphs and tables that we think are the sort of the high level points of interest. Truthfully, this is a very complex topic, as all of you know. And so there is a report that will be posted on the Midwest Center's website. It'll be a fairly long report. It's not quite finished yet because I'm still trying to make things look cleaner, but it's going to be about a 45-page report. The slides we're using in this session, the PowerPoint slides we're using in this session, Mark has made them available for you to download in a PDF format if you want to be looking at them at the time. But again, you can minimize the people numbers on your screen so that you can see the graphics fairly well. And again, we're not trying to get into all the data. We'll show you the depth of this. Part of what we're doing is really explaining in a way that people probably haven't thought of it before. A lot of you, unless you've been stuck with listening to us before, you've been looking at this system that we're dealing with from certain ways. Trying to get this to shift to presentation mode. There we go. But as is often the case with some of the research we do, we try to help people see things in a somewhat different way, kind of a different lens to some of the things that candidly all of you have been working on for a very long time. And thank you for all of your work in that space. But we keep trying to learn, of course, and I think that's why you're here. So we're talking about this from an ecosystem perspective, and I'll explain a little more about that in a minute. But the idea is we're giving you initial insights, and we'll be working from there to give you some details and highlights, and then hopefully we'll build your appetite for looking at the full report and, frankly, sharing this information with others. Now, the project is to collect data and create a research-based ecosystem map. It's a little bit geographic. It's mostly conceptual. And it will help us understand, I think it is helping us understand the system of programs and organizations that are out in the greater Kansas City metropolitan area. And we're focusing on a 6-county metropolitan area. So it's 4 counties in Missouri, Jackson, Platte, Clay, et cetera. And in Kansas, we're looking at Johnson and Wyandotte. The thing about this system and these kinds of projects that we do these projects to try to help us understand what's going on in what we refer to as wicked problems. We didn't invent the label, but I like the label because wicked problems are problems that communities try to address, but they're impossible to understand or resolve within one organization or one county or one place. In other words, the problems are wicked because they transcend organizational and professional boundaries, and they also transcend geopolitical boundaries. And we'll talk a little about the spread of those things in this system here. By the way, we talk about it as a system. It's not a system anybody in their right mind would design. It's what we're living with because it all grew organically. You know, let's face it, in the earliest days of dealing with homelessness, a few folks here and here created programs to help some segment of the population that seemed like they needed and wanted some assistance or support with regard to homelessness. But the truth is, all these things grew and developed, and we would argue that part of the value of mapping it at this point is there's so many actors out there, it's impossible for most people to keep track of, well, who's out there and where is it? So the result of this project is certainly presentations like this and our report that will be posted. But another part that will become available to the public is an actual database that provides a lot of information, and you'll be seeing the highlights of that information in this presentation. That database is to become a community asset, and we're still working with a couple of organizations to talk about where it could go. So I will admit that I have stolen this, but I'd like to do it with credit and appreciation. For those of you in Johnson County, Kansas, or who have attended the United Community Services recent summit, you saw a video that had an outstanding graphic talking about, and then the speakers in the graphic were talking about aspects of dealing with homelessness. Our work in this project draws a very specific box, if you will, around this. It's such a complex system, and there are so many programs that you have to draw boundaries somewhere. And we're actually looking specifically at the part that's most focused on the programs and organizations that are most focused on this end of the system. The graphic that they used in their video at UCS talked about the continuum from housed, people who are living in but maybe challenged with being housed, all the way across the continuum to unhoused, and the challenges, the unique ways that we have to try to step in and address and understand and then work with people to help with that. So our study took this slice of it. And so this will become relevant in a minute, and Cindy will tell you a little about some of the challenges we've had figuring out what's in or out. Because, you know, I mean, housing is a huge space. We're actually not looking at housing. We're looking at homelessness. In a sense, I don't equate the two, but many of our colleagues, many of you on the call perhaps, refer to and are looking at houselessness. I'm not going to get into the semantics of this, but what we are looking at here are the programs and the organizations that host them that are working in this space over here. And so, for example, you'll find that we don't have the, actually, even in just trying to collect data, and Cindy will tell you about that in a minute, we identified organizations working over here in this part. There are about 185 organizations, each of them with at least one program in the potential homeowner, new homeowner, working on problems for cost burden renters. We're not in that space. We're actually looking at the intervention, the programs designed to intervene with vulnerable populations, with people experiencing homelessness, with chronic homelessness, and those who are trying to address that. Is that less than the whole system? Well, these are systems that are nested. And so you have to start with a segment that I think is logical and complete enough, but it certainly isn't the whole picture. I have folks tell me all the time, well, the way to address homelessness is to build enough houses and apartments and other places to live. Well, that's kind of true, but it is, many of you know, is a little more complicated than that. So as I've said, this is an ad hoc and diffuse system. It's multiple functions, and we call it a system because there are programs in it that actually do provide services. But I want to raise to your awareness, because some of you don't take much time to have to worry about this. This is not just frontline direct services. You know, there are certainly some outstanding programs out there that are going to meet people under bridges and trying to help them and things like that. But a system requires funding. It requires organization. It requires lots of dimensions, activities, if you will, that are not frontline. Our study categorizes those too. So, of course, emergency intervention and direct service are programs that are involved directly in that, programs that provide services to those with unique or special needs, even those programs that exist largely, and by the way, most programs tend to do a couple of these, but you know, communication, consumer education is a part of it. There's case management and the coordination parts of it. But by the way, the system requires entities that coordinate the system, and I'm hoping that our work will be very useful to those organizations, notably the continuum of care housing organizations. But by the way, they're not the only ones who are trying to coordinate. And, you know, I'm going to shock you all by saying something that you may not have thought before. Okay, maybe you did. There are so many people trying to run the system that they're sometimes running into each other, even though they're kind of chunked out by geographic specialization and things like that. And I hope that we can continue to think about how to further add coherence and efficiency. By the way, efficiency is not going to be low cost. It's just more efficient than maybe some of the aspects now. By the way, even advocacy and policy, the folks who are out there arguing for changes in laws, those who are making laws and creating state governmental programs. I mean, we've got government in here too. So it's a very diffuse system. We'll talk about the categories later on, but I want to highlight this. The center of what we look at is programs. Programs are clusters of activities targeted at serving a specific group of people or population or some segment of our community and making a difference. I mean, ideally, our programs have a logic model, and so this is what we do, and these are the short-term results, and these are the long-term results. Those programs live in agencies or organizations, and of course, as many of you know, as many of you live with, the truth is many agencies have multiple programs. You've got a program for this segment of the population, a program for this need to be addressed, things like that. So we talk about programs, we talk about agencies. This is all in this complicated database that we have. And then we get into things like, what is their role? What's that program's role in the system? I'll explain socio-ecological focus, which is a very jargony, but actually relevant characterization of some of what we analyze. We'll talk briefly about funding sources and the focus of the programs. We do try to identify who's specializing in different areas. Now, I will tell you, we take at face value an organization, a program that says we're here. If they say we're in this space and we're doing this, unless we have reason to believe they're out lying to us and we're not out doing lie detector tests, they go in the database, and we try to describe them as best we can, including why are they there, how are they funded, what part of the region do they work with, how big, what's even the scale of their programming, and you'll see some of the results of that in a minute. Now, we identified programs. We'll tell you the specifics of the data in a minute, but I'm going to hand this off to my associate Cindy, who actually had the unenviable job of, it's fun to lead the graduate assistants that are doing the research. What's not enviable is trying to help people make sense of this and then go out and hunt for all the programs out there. So Cindy, you want to tell us a few minutes of about what you have been doing and how that works here?
Yes. So there was a couple of things to get started on this. The first thing we had to do was to create the database. And that's kind of what Dave just showed you, all the different variables that we were going to categorize. And so to start with that, we have, in fact, I could show you here. Here's the book that I read first, that had several reports in it. It was the Greater Kansas City Coalition to End Homelessness Needs Assessment. The Balance of State Gap Analysis from 2019 is in here. And the 237-page HMIS report is in there also. That gave us a lot of information on all the different types of housing that's available, many more than we realized, the different types of funding that goes to certain things. And it helped us to start being able to identify all the different pieces of those variables that should be included. Some of them were very simple. We had done this program before and there was services being offered all kinds of places. This one, basically service delivery was a facility, the organization facility on the street or online. It was just as simple as that. Other variables were pretty complex. Dave's already talked a little bit about the population, and we had 19 different populations that we could categorize things as. Kathleen already mentioned reentry. That was one of them. Mental health, youth, domestic violence, different even age groups. So youth under, minors, and then young men. What else do we do? Families. So all kinds of different ways to chop up the data and look at things differently. We had 14 different types of housing that were available, 13 different support services that came along with the housing, which might be budget training or food assistance, all the kinds of different things like that. So once we got the database together, then we had to start putting things in the database. We started with Ann Williamson, who was a former UMKC person, now is at Little Rock, University of Arkansas at Little Rock, was working with KCMO on an asset map. So we took some of those, and we'll kind of talk a little bit more as we go on today about the difference between Ann's asset map, which is programs that are available, can help the homeless situation, people in the homeless situation. We didn't put all of her things. In fact, we put less than I thought we would in there, because there's many programs that can help homeless people, but they're not intended to help homeless people. And we were really focusing on programs that were designed, created to be that homeless intervention. So that's kind of a difference, but we started off with Ann's list. I think we had about 100 organizations or programs there. We started with advisory councils, which Dave will talk about, I think, in a little bit more, but we're good at mapping. We're not experts in this field. We don't know homelessness. So we did go out and to the community, and we had an advisory council that could help us understand the community better. When we had our first meeting of 3 with them, we asked them who should, what should be in our database, and they offered 400 programs. So we started to winnow through that. We also went to United Way, and I think Jim McDonald's on this call, or on this Zoom this morning, and thank you to Jim, connected me with some people with the United Way's 211, amazing system. They sent me over 39 different types of service that we then were able to start to kind of pull from that and use some of those things also. We looked at resource lists. So the KCUR had one, a street sheet is one. There's all kinds of resource lists for people with homelessness. That was another source of things. Membership lists, who's a member of and reports to HMIS data, who is members of the Greater Kansas City Homeless Coalition, who are members of the COCs, those types of people we looked. We followed the money a little bit. So where did some of that federal money go? Where's the HUD money going to? Where's FEMA money going to? Some FEMA money supports programs like this. Some veterans money supports programs like this. At our second advisory council, we asked them who's funding, who are the funders in the community. And they gave us a lot of the foundations, the businesses, the corporations in Kansas City that were helping, that put money into this area. A lot of that, so we had a lot of these things that we did have to go and then vet it ourselves and determine what qualified and what not, but these were great places to start. And then of course, people started to learn and people would give us ideas, and that was all wonderful too. That all said, we did start down this path, and it's definitely a learning process. So once we got these things in line, once we created our database, it wasn't done. It morphs through the process. And so the very first advisory council meeting we went to, we had this database and we started to talk to them, and it got very gray very quickly. We sort of were on, it's this or that, and what belongs in and what doesn't. Dave's already alluded to this a little bit. Became really gray, and we didn't know what to do. One of the first things that was brought up was Evergy, who has programs that can help out. When we started looking at it more though, and talking to Evergy, they're like, we don't have programs for homeless people. There's programs that homeless people might be able to partake of, but really you have to have a home in order to get energy, in order to get a discount or a waiver on your energy. So yes, they were helping, but not so much. So we had to really clarify that. Rent assistance and energy assistance, utility assistance was a real gray area. It was a program that they designed specifically because if they didn't do it, it would, it was a prevention for homelessness. So we had to really watch that. It was one of the things that we kept going back to over and over was it's homeless intervention programs, not homeless serving programs. And that was a distinction that we had to kind of use as a benchmark for a lot of the things that we were looking at. The database, let's see, many of the programs were things like Habitat for Humanity, like Dave alluded to earlier. We build enough houses, the affordable housing will be there. But that was at that other end of the spectrum. Home repair programs were not included a lot. In fact, I don't think any, because you had the home in order to repair it. So those things, but many of the people that are working in this field, who are the ones that were on our advisory council, were working with all these agencies. So offering us up who they were, but they weren't actually designed to be homeless programs. Many programs serve all people. So healthcare facilities were part of it. There's a few programs that actually go to the streets and serve people out of some kind of mobile facility. Those were included. If it was something specific, there's I think one that did eye care in the streets, that did some mental health screenings in the streets and things like that. Those were included. One we kept getting brought up over and over again was KCATA, because they have free transportation. So it was a way for the homeless to maneuver the city. Again, it was not something, the KCATA is not free because in order to serve homeless people, it's free for everybody. So that was not included. One of the big distinctions too, or one of the big discussions was on pantries. There's many, many pantries in the community. They're for everybody. So very few pantries are included in our list. The report Dave alluded to though has some of these periphery, auxiliary, whatever, how you want to put it, pantries will be included there, and the number of pantries will be included in it because they obviously are important for homeless people. So they're out there and they're included in the whole system, but they're not in the database. There's community meals all over the city, many weekly community meals that are all kinds of people are hosting. Most of those were not included because they were kind of neighborhood based or something like that, and anybody can come and get a meal. There was a couple, and I think Washington Park is one that sticks in my mind, that was created to serve the homeless people in Washington Park. It's one night a week that they do that. A few other people wander in, I've been told, but mainly that meal is for the homeless population in that area. So that was included. This could become a couple of the things that kind of became a challenge as we went through was population. As I said, this was a learning process to go through this, and we continually altered and pivoted and moved and adjusted the database. Even at first, we were capturing if this list of 19 different populations, we would put everything, because many organizations served everybody. So we'd put yes throughout the whole thing. And that just for data reasons wasn't really helpful. So we started putting in only if you help them do you get categorized as serving that. So domestic violence shelters were marked yes. Otherwise they were marked no if you were a domestic violence shelter. If you specifically helped re-entry, as Journey to New Life is, then you were marked as one of those people, so that we can pull the data up later. We'll have just the ones that are helping those, not the ones that may help them or would not turn away people. Obviously, a lot of places don't turn away people. That also became a really sticky point with geographic scope, because nobody's going to say we won't help somebody if they get to our door or something like that. But there was like centers that were sort of neighborhood centers, and they were day centers where people could come and hang out or something. And of course, they're not going to turn someone away if they're in Independence and someone comes from Olathe, but they really weren't for that. And we had to kind of finesse it to make sure that we were really trying to represent the scope of their service area.
One other, have to move on now pretty quickly.
Okay. All right. That's about what I was. So my final point is just that we may still intervene after today. Go, Dave.
All right. I'm sorry to interrupt you. But
that's okay. I know. I was afraid of that.
Since we have a huge project, and the overview, of course, helps us make sense of what it is you're about to see. It sometimes takes a little while to figure these things out. So, by the way, this is going to be the nicest, cleanest slide you'll see, because we found 200 in the scope and focus points that Cindy was describing. We found 214 organizations. By the way, we try to look at all three sectors: nonprofit, government, and for-profit. And we even look at collaboratives that cross sectors to try to intervene in homelessness. And what we found was 323 programs. They're spread across nonprofits. Of those programs, 62% of them are nonprofits, 30% are in government. Now, several of the government programs are actually the entities like HUD that are funding. So the work and the money flows down into the system, and you'll see just a hint of information about that too. But 323 programs, particularly in the nonprofit and government space. Candidly, there's an exceptional array of work in the for-profit world, but it's mostly in the housing development, redevelopment space, things like that. So our database is substantially nonprofit and governmental organizations. We don't have a homelessness business database in place. There are a couple that connect here, and we'll mention them, and you'll see them in the report. So by the way, just in terms of how much is going on, and I can imagine some of you are going to say, wow, I can see already we got way too much going on. I suggest that be an observation you consider, but actually not judge at this point in time. And I should say, our work at identifying programs is not program evaluation work. We don't evaluate whether they work well or what it is that, what we only look at the functions. It's more like a census in that way. I've had some people say, well, aren't you going to tell us where there's too much duplication, or tell us that somebody's screwing it up? You could move down that road in the future, but the truth is we're looking at this whole system from a different perspective. So in the Kansas City metropolitan region, the counties we looked at, there are 235 programs. Again, often there's 2, 3, 4 programs in an organization, but the 75% of all the programs in our database are working in Jackson County. Now, some of those are also working in others, even all 6 of the counties in our study. But we looked at Jackson, Platte, Clay, Cass, Johnson, and Wyandotte. Actually, I was surprised that I expected fewer programs to be working in Clay and Cass than actually is the case. There's a lot more activity out there, and kudos to those who are making sure that those areas, Jackson County is clearly at the core of the region for multiple reasons, and so we can expect more programs there. But we're looking at distribution, and of course, population numbers are relevant as well. The organizations that host these programs, we look at how big they are, because there's often a sense that, you've got something that's a really large operation. Certainly the governmental entities like HUD and the Missouri Housing Department, places like that are are very large organizations. But by the way, and again, these are not the program's budgets, but the budgets of the organizations that host those programs. It's fairly spread out. 9 of them were less than 100. 9 of those 323 were, well, actually, these numbers are tied to 121 because they're only describing the nonprofit-based programs, not the governmental size, because these governmental agencies have budgets that are so much larger and more used for more things than just our homeless intervention folks here. But you will see that even at that, the nonprofits, a fourth of all the nonprofits that are hosting these programs have more than $10 million in annual budget size. But there's a lot of others. And of course, as we'll talk about in a minute, the scale of the program influences, it's both chicken and egg with regard to where it's happening. And so for example, you've got programs operating at the neighborhood level. They tend to be operating in smaller neighborhood organizations, maybe $100,000, $200,000 a year in budget. The scale of the programs, geographic scope of these programs is interesting to look at. And of course, when you're looking at programs that are statewide or federal, by the way, most of the money that actually is operating these programs in this region, if it's coming from the federal government, it's coming down into state and regional geographic sort of disbursement systems, if you will. The programs, again, from leadership, funding, performance, leadership, communications, and direct services, only 15 of the programs are operating at the neighborhood level. That's probably not surprising. Just because it's a level of development that often has resource constraints and other conditions that make that likely. A fourth of the programs we identified are operating in, maybe they're even hosted by a single city or municipality, and 65 programs, 21% of them are working in multiple cities, maybe Jackson and Wyandotte County, so you've got multiple cities there because the county involved. One of the things that we had to add, because we didn't look carefully at it until our advisors said, hey, folks, by the way, kudos to the advisors. Thank you for taking the time to try to shape us up where we did. We ended up paying more attention to school districts than we thought, partly because of McKinney-Vento and the programming that it does and must occur there in public school districts. So 13% of the programs were operating at the geographic space of a school district. And as many of you know, school districts in our region tend not to align with geopolitical boundaries of cities, counties, et cetera. We had a fourth of the programs that were working at the scale of the greater Kansas City metropolitan region. And as I said earlier, just 7% are operating at a statewide or multi-state level. And the significance of that is these are, going back for a moment to that functional analysis of our system, these are coordination entities, these are the funding entities, these are the policy-making entities. Those are also in the database. Now, of course, there's the outlier that we had to take into account, which is we have a number of programs that don't have a geographic scope because they're internet-based programs. They're providing information. And even if they're providing information for one city, like Roland Park in Kansas City, in the state of Kansas, once it's online, it's there for everybody to see. Now, this is where it starts to get ugly, but it'll give you a sense of what's in the report. And, we're not trying to make this an infomercial, but the reality is it's going to be useful to you, I hope, to see the depth and variety of what's going on in the housing space so that you can take a little bit more time to look at our slides after the session, or even potentially you can get the report and look at that as well. There are a lot of programs focused on prevention, and as Cindy was alluding to, there are a lot of them on the boundary of this system. 125, about 40% of the 39% of them are focused particularly, explicitly, always on homelessness and intervening with homelessness. There are multiple types of housing out there, and we'll talk who those housing programs are serving in a minute. But there are transitional housing units. There's placement for permanent housing, working with people who are on the streets, but to help them get there. several federally related programs coordinated through continuum of care, like rapid rehousing, emergency shelters. You can see the distribution. I will say I was struck as I looked at the statistics at the small number of programs for a couple of groups. I've heard a number of things about motel voucher programs, but those who are actually operating that at the street level, there's only one in the region that is operating as a discrete program. There are 3 that are maternity group homes. I've worked with several in my career here, and so I actually was surprised to see that. But you know, and there's only a couple that are in bridge housing. These are, by the way, specific categories of funding, as some of you will recognize, that you can get funding for. But there is not, you know, people say, wow, there's hundreds of programs working on homelessness. Well, there are, but there are a fair number of specializations tied into this. Now, here's who's being served by these programs. And this is metro-wide. We'll, in the report, the written report has statistics by counties as well to help you hone in a little bit more on that. But just to give you a general sense for the region, about 6% of the programs exist explicitly to serve young adults. 18% are there to serve runaway youth. 18% are working with unaccompanied minors. There is sometimes, of course, overlap in that. We did not find a lot of specialization with regard to gender, although you can imagine that domestic abuse facilities that are in this space helping homeless women who are homeless because of, well, homeless people, period, because of spousal abuse or domestic abuse, they're significant. 8% of programs are serving women, smaller percentage working on men, and actually, given their prevalence in the population, it was interesting that only 5 programs, which equates to a couple percent, are working on dealing with serving single adult males. We have specializations in 5% working with those addressing addiction challenges, 4% addressing those with mental illness. I actually thought that would be higher, but I mean, there are many programs, by the way, that don't exist specifically to serve these populations, but their services kind of cross into that. There are some programs, of course, but less than 10% actually, that focus on low income. Obviously, the actual characteristics of the population are about that. A small number, excuse me, I alluded to this a minute ago, 3% are working on the needs of pregnant youth, parenting youth. 5% work specifically with families, with children, trying to deal with that. I mentioned spousal abuse earlier. 3% of the programs exist very explicitly to serve those fleeing domestic violence. We do have a couple of other categories that are interesting to look at. I thought we'd find more programs working on immigrants and homeless, but there are only a couple of programs in the region that are doing that. By the way, 3%, which is about what I expected because of some work I've done in this space, about 3% of our programs explicitly seek to work with those re-entering our communities after completing their prison sentences. And so, again, this array gives you a sense of the variety of categories that really is significant for making this system work. We look then at the type of support services that they provide, and if you're in this space, you're probably aware of this, but a substantial share of programs provide what seem, to those of us who are housed, like fairly basic and maybe even unthought of categories of assistance, but it's all in the category of other. But literally having a place to go shower, a place to do laundry. Those programs often have some legal assistance and others. Almost half of our programs are serving that need. About half the programs we identified as part of their work, this isn't too shocking, are doing outreach by putting together housing information that can head out into the street. And then there are about 25% of the programs actually have people on the street working out with those who are homeless. You can see the other categories of support that are provided here. Again, Cindy alluded to this. There are a couple of programs that work specifically, 10% that work with utility assistance. But the distinction to be made here is they're in our database because they are targeting those who are immediately or imminently at risk of or suffering from homelessness. And so it's utilities, but it's not just helping pay the bills. The same is true with mortgage or rent assistance. And of course, if you're homeless, even having something like a mail address, help with a computer to put a resume together, things like that, those are all needs. A lot of programs will lump a number of those things together. Where are they services delivered? Well, 60% of the organizations offer these programs in their own facilities. A small percentage, as you saw in the previous numbers, if you could focus on them, you've got a few programs that are provide safe haven housing, actually a facility of their own, SRO housing. We've got 18 different emergency shelters that are operating in town. We have less, but I think it'll be interesting to see what continues. By the way, I should have said this when we talked about the database at the beginning. One of the realities of databases is that it's accurate as of the day you run the numbers, or actually the day you finish collecting the numbers. It will change and evolve. Now, it's not going to change radically. We won't end up with 40 bridge housing service programs in the next year. We could, but one of the things that I hope this study helps people think about is what aspects of these potential service categories belong in our program. 35% of our programs now have explicit focus on creating online resources, and as we mentioned earlier, nearly half are into the housing information category. When we look at the blend of funding, and I don't know, almost all programs are drawing on multiple sources of funding because they just need a diverse and more resilient resource base. I will tell you that I actually was under the impression that more programs are, than is really true, drawing funds from federal and state governmental entities. Half of all programs, by the way, again, just to underscore the point, most programs are drawing on some mix of these, but there are a lot of different things. And one of the things that surprised me was the number of programs lately, and this is probably a reflection of the pandemic's impact, they're drawing on money from FEMA. Anyway, private philanthropy from foundations, the United Way, et cetera, half of the programs in our region are drawing on those resources. That may well be a reflection in part of the special programs put in place during the pandemic by the United Way, by LISP, by Mid-America Regional Council. I shouldn't say maybe, it undoubtedly is true. But by the way, almost an equal percentage are drawing on individual donations and individual philanthropic gifts. The distinction here being they're not from foundations or federated campaigns like the United Way. I was surprised that nearly a quarter of our programs are drawing on FEMA money, or have been for the last couple of years. We haven't asked for trend data, just what's going on in the recent past. Excuse me, allergy season's kicking in here. So you can see that there's a variety of funding sources. 10% of these programs actually do generate some of their revenues from fees for services. Now, it's generally not fees for services for the homeless. It is fees for services to partner organizations, or a lot of our facilities, as you know, City Union Mission, others, they operate thrift stores. And so those monies are explicitly being targeted for support to help in this domain. State level money is small, distinct. And by the way, they're often, one of the things these numbers don't tell you is how much in actual dollar terms is going to these programs from these particular sources. Now, this is the slide that far out will drive any PowerPoint theorist or leader crazy, because this is a huge list, but this is the list. These are the functions that exist in our system, this ad hoc ecosystem to intervene in homelessness. And as you see the list, they sort of vary. At the very top, it's system leadership, system coordination, integration. By the way, every program that we identify, we categorize into one, or sometimes they'll be doing 2 or 3 or 4 of these different, they'll be performing those different functions in the system. So one of the things that I do hear from folks, though, is, oh, well, you know, I'm surprised homelessness isn't more effectively intervened, addressed in our region, because, you know, we need to have a coordinated approach, and, you know, we've got that coordinator. The funny thing, because I have a bad sense of humor, is what people are thinking of is a coordinator, but we don't have one coordinator or collaborator connector in the region. We have 4 continuum of care organizations. And by the way, if you don't want federal money, if you're trying to stay away from federal money, you may not even connect with them. So, you know, we have different folks providing leadership in different components, either geography or functions in the region. We map whether, you know, we identify what programs are tracking numbers, are trying to figure out where and how we're doing things. I mean, our work in this project is system monitoring and research and knowledge management, gathering data. We look at who's in the funding and finance category. Who's making laws about this stuff, and laws and or city policies. You know, city governments are all in this, because most cities in the region do in fact have policies with regard to homelessness. Advocacy and mobilization. It's the professional education, by the way, is training for those who are actually working in careers dedicated or focused substantially on intervening in homelessness. And we found very little in that space. Certainly there are many people being trained as social workers, but they're not participating in, there just aren't many programs designed to focus on training for those who are actually providing the services. The other services in the function list here are things that are all more on the front lines, and you'll see how they break out in a minute. So the system, if you look at those functions and where they're happening, by the way, first of all, you would expect this pair of columns here is the number of programs in that function in the greater Kansas City 6-county metropolitan region that we're mapping. So as I mentioned, we have more than a few. There are 17 programs that are all working on some aspect of organization and integration across the region or some segment of the region. Actually, nobody is doing something that is truly organization and integration across the whole region. There are entities who are larger and some that are smaller. I identified how many, which counties were served by these entities, and that's what this set of columns means over here. The interesting thing is there are 17 programs in this category. 6 of them are working in Jackson County. Now, some of those are working in the whole metro, so their numbers, there are 3 in Wyandotte. Those 3 are probably also working in Wyandotte and Johnson, or even across the whole metropolitan region, which is why you see these varying numbers. The lighter green color, if your monitor looks like mine, up here of these rows, these are the leadership system organization categories. The professional segment of it that I thought, frankly, was going to be more actively represented than it is advocacy, mobilization, and again, that professional development for the people who are working in this space. And by the way, a good share professional development is done by like the continuum of care organizations, because they're training their agencies to work with the HUD funding system and the data HMIS, the management system, data management system that you have to deal with there. What's interesting to a lot of people is what we see down here, which is what's the distribution. Not surprisingly, there are a lot of organizations and programs in the communication category. We would not expect to find 200. It would be really problematic if we had 200 in the system coordination category. But on the front lines, these are entities that are out doing more work Again, if you think back to my slide of geographic scope, some of them are working at the neighborhood level, some of them are working at the statewide level. So we have quite a mix, but they're spread quite evenly across the whole community. When you get into emergency intervention, it's interesting to look at the distribution. There are 35 programs that are providing emergency intervention. Again, some of them in multiple combinations of these counties, but I wanted to create the frame of, if you're in Jackson County, how many programs exist. By the way, I don't know that we said this directly, but the database that we'll produce will have the capacity to be analyzed and queried so that people can say, well, how many programs and what are they? We can print out names and locations of the programs operating in communication or consumer counseling in Jackson County or in Johnson County or Cass, wherever it might be. I will say, generally, building on a comment I made earlier, I was really, in a sense, pleasantly surprised, although it raises the coordination issue again, of how broadly across all counties the presence of services at all of these levels exists. I really had thought there would be less presence in Clay, Cass, maybe even Platte counties than we find in Jackson, Johnson, and Wyandotte. And while there's an element of that, clearly the place with the largest number of programs is Jackson County, but that's also where you find population and people with need. Now there's multiple ways, and we didn't try to exercise that process to check, well, how many, for example, per person who's homeless or something else would we have? Those kind of metrics would be relevant for some of these things, but not for others. The other thing, and in the interest of time, I'm not going to go into the details. There is a chart that you'll see in a minute. It's really ugly because it's so data heavy. But when we look at the system, for each of those functions that we just described, there are actually 3 dimensions. And for those of you in public health, you'll recognize that this is very common in a socio-ecological analysis of a health problem. We employ it in our system analyses as well. So we look at not only, to go back to the earlier slide for a minute, how many programs are working in emergency intervention, but then which of those programs have formal structures, like they're enforcing law or policy. So by the way, a city that adopts a set of policies or ordinances about emergency intervention would be acknowledged in this category. Getting closer to real life behavior and activities then is the social and physical environment, the programs that exist to shape the environment, try to create, for example, the emergency places that people can go to get away, things like that. The one that's squishy, but those of you who are in this space know that it's actually pretty significant from the homelessness intervention perspective, is the transmission of behaviors and practices. In a sense, the systems and structures are governmental. This is kind of a hybrid of community programs and governmental, but the transmission of behaviors and practices is very much on the street, helping a veteran with PTSD to try to get that under control, the homeless veteran, I should say. And of course, we have examples of that. So, just the second slide here just gives you an example of the key things that these programs in these categories are addressing. And some of them, it's not unusual that you'll find something in the social environment and in the behaviors and practices that an agency will be working on both, because you've got social workers trying to help people learn to cope with these things. So this is the ugliest chart of all. We're not going to read through it, except that you will just see those same functions in this graphic are sorted out in terms of the 17 in system integration, how many are in policy-making formal structures, how many of them are in physical environment or social environment, and so on. So with that, we're going to stop. I do want to just leave this for a second. It's in your slides, so you can send us notes. The team at the Midwest Center includes more than us, but the people who are to blame and or are on point for this is Cindy and me. And so drop us a note and share questions. By the way, we do intend to do some additional programs and reports down the road not so much reports, but helping take segments of this database and share it with the community at large. So I'm sorry we've gone a little later than planned. Navigation sessions are always tough because we're only working for an hour, although we'll stay on longer if people have some questions or other things that they would like to raise. We have a few minutes. Cindy, I don't know, has anybody posted a question or are they just stunned by the pile?
Cindy, you're muted.
You're muted, Cindy.
Yes, they are stunned, but they're coming out of their stupor, a couple of them anyway. So we had a question about collaboration and wondering if it was organic or intentional and if people are talking to each other and stuff. And so I'm going to talk first and then I'll let you add to it, Dave.
Sure.
I do think, just from my impression, this is nothing that there's no data on this, but just I did talk to a lot of people out there. And the answer is yes and yes, I think. So there is definitely organic collaboration. There's people working with people. I had a talk with one woman who was telling me that she kind of sends people over here to get the housing and then she coordinates with the people who have the furniture and this. And so there is stuff, people doing little pieces of things and people are coordinating that. I do feel that these guys the people working in this area are making it happen any way they can. And so that's happening. There is some intentional stuff going on. You may be aware of the Zero KC project. There's also the Beehive. So there is some intentional to get people together in one place to do things. And so, yeah, yes and yes is the answer a little bit. I do think that people also are just doing their work, and if they have the luxury to coordinate, but they're just trying to carry out and serve the people they're serving. And sometimes that involves collaboration. Sometimes but the effort to go above and beyond to collaborate for the sake of collaboration can be a luxury, I think, sometimes. I don't know if you want to add to it, Dave.
Well, I would think on everything you said. The collaboration tends to occur more organically unless you're in an organization whose mission or mandate actually requires coordination and connection, because there's so much to do. I sometimes use the metaphor when I'm talking about coordination and trying to figure out, trying to encourage people to be thoughtful about their roles. I don't know how many of you ever watched kindergarten kids playing soccer on a soccer field, but what's that look like? Well, everybody's just huddled around the ball, kicking and whacking it, in theory, the ball, but they're usually hitting each other too, except for the two like my son who are in the back throwing dirt. But you look at Sporting KC, they're not all huddled around the ball. They're playing positions and they're doing that to make sure that the collective effort adds up. We're on our way and people regularly try to start doing that. In fact, if I go back for a minute to this slide of just the functions, entities that are trying to encourage coordination are in this space. And so of those 17, you've got a couple of things that are governmental. You've got a few things like the continuum of care organizations that are quasi-governmental, and they're trying to coordinate things. They are coordinating, especially when they go to the federal government for federal money. The trade-off, of course, is, as Cindy was alluding to in a way, people are coordinating on some things, but it takes time to coordinate. And a lot of the frontline service providers are worried that every hour I spend in a meeting talking about organizing us is an hour I'm not helping someone on the street. Now, Einstein's also credited with saying if he had an hour to deal with a complex problem, he'd spend 55 minutes of the hour analyzing it and thinking it through, and only the last 5 actually acting on it. He wasn't working in homelessness, so maybe the quantum physics is not relevant here. I don't know. So thanks for that. Other questions, comments? We've got a couple minutes and we can hang on for another minute or two.
There's a question on statistics of who those people are, so on the individual level, and who would qualify to be a veteran, or teens, or basically the populations. Not really. We don't have a number of the individuals and stuff like that. Our analysis is on the program level. I don't know if you want to say more about that, Dave.
Yeah, well, I would underscore that. Part of what makes this study and this type of study unique is that we're looking at a system in terms of the structures, programs that are out there making a difference. And future work in this space ideally would actually take that database, if you will, and then for every program there, pull additional data about numbers of people and all of that. There are entities in town who've been pulling that data, and certainly applicants for certain federal and state grants, some foundation grants are actually finding, putting program numbers together. That said, we're still kind of fragmented in the metropolitan region. United Community Services has numbers for Johnson County, Kansas. The Greater Kansas Coalition has data for Wyandotte. I mean, the federal applications are all grounded in the numbers, the need that the continuum of care organizations flag. And when it comes to people who need it, Precious just popped a note in the chat. I saw that. So, the point in time count is literally, how many are there? Although I will tell you, point in time captures one category of homeless, and in fact is just not relevant to, I would say 45 or 50% of what's going on in the programs that are listed in our database, because they're not serving people out under bridges or nearly in that state of homelessness or houselessness. Shall we take one or two more and then hang it up?
That's what I know. If anybody has a question, just raise your hand. You can ask it or write it in the chat. We'll be happy to address it.
This is definitely a lot of information, which is why we put this layer out. Believe it or not, this is the opening layer, and we've got more detail in the reports. And so we will send information to everyone who's signed up for this program series, and as well as just publicize it more broadly through the region. The questions can continue to come, and we encourage you to let us know what you're thinking about. So I see a couple of questions are popping up now. What surprised our team most? I won't speak for the team, but I've highlighted in my own comments as we looked at some of the numbers. I'm struck that there are many more actors out there in all counties. It's much more balanced across the 9-county region, the 6 counties that we studied, the services at the frontline level. I am not surprised. I am concerned about the challenge of coordination and the use of resources and all of that. We hear about that regularly. So we'll be owning up to a lot more, maybe not surprises, but a study of this sort also, of course, deserves an infographic and an executive summary, and both will exist later. They don't today. So with that, I
just want to add to that, just one of the things that surprised is the wrong word, but I was just so touched by the passion of the people working in this area. They're just like, get this work done, and just, their care for the people that are homeless was just really inspiring to me. Yeah. Not that I thought that was a surprise, but I really like to see that.
Thank you. Yeah, I just see a question. When is the finished report available? I expect it to be posted toward the end of next week. So with that, Julie, we should probably pass the baton back to you to offer a benediction, and anything else, any other warnings needed.
Well, I just want to say thank you again to Dave and Cindy for all of this work, to the Block family and Hall Family Foundations for funding this work, and just a huge shout out to everybody that's working in this industry on this complex and challenging issue. Look forward to this being posted in many forms and additional discussions to come. So watch your email for more from Mark about that. And with that, we will let you all go, and we hope to see you in the next one. Take care, everybody. Bye-bye.